Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
deficiency of vitamin C or scurvy. Deficiency of vitamin C or scurvy. Here the initial symptoms the child presents with irritability and reduced appetite. Later the child will have petechiae because of increased osmotic fragility, and there will be bone pains like subperiosteal bleeding is seen, and you will also see pseudoparalysis is seen with joint swellings. Pseudoparalysis is seen in scurvy and also in syphilis. Mucocutaneous findings, you will see poor wound healing with gingival swelling, bleeding, and ecchymosis is seen. There is scorbutic rosary is seen. These scorbutic rosary are seen in rickets. Scurvy. Scorbutic rosary are seen in scurvy, whereas rachitic rosary with sternal depression is seen in um, rickets. So rosaries can be seen in rickets, scurvy, and chondrodystrophy. So the main differences between scorbutic rosary and rachitic rosary is in scorbutic rosary is angular with a sharper step off, and these scorbutic rosary are tender, whereas rachitic rosary are nodular or dome shaped and they are non-tender. A child with scurvy also will have anemia due to bleeding, iron, and folate deficiency. There will be psychomotor changes because of the affecting because the neurotransmitter metabolism is affected in scurvy. Skeletal muscle degeneration and cardiac hypertrophy is also seen in scurvy. Ex-
thank you and thank you for watching.